Welcome to Community Connections with Children's Services Council of St. Lucie County. I'm just one of your hosts, Sean Boyle. With me is
Ashley Ma.
We did not.
You know, we skipped 1 week, and look what happens to you.
We got a countdown from the official production office, and it just made me laugh. But welcome to the show that's all about connecting you, the viewer, to resources and things that are available in our great community we call St. Lucie County. Now, we at the Children's Services Council are not media professionals. You could tell that right in the first 5 seconds of this program. But what we do at the Children's Services Council, we have 5 priorities, and we are zero in. I'm just making words up.
You are.
We are very, very focused on these 5 priorities. They are: 1, making sure every baby's a healthy baby; 2, stopping child abuse before it happens; 3, keeping kids off the streets; 4, keeping them in school; and 5, keeping them off drugs, alcohol, and other risky behaviors. When I say that we focus on these and we're zeroed in, which I finally was able to say, is that we develop systems of care and fund programs that are available to all families in those 5 priority areas.
That is right. And we utilize this show to introduce you to some of those programs and to talk about our focus on those priorities. But there are lots of other ways that you can get access to that information. One of them, obviously, is on our website at cscslc.org. We also have on our website now a pretty lengthy history of reports and publications. And I see that you brought some with you today.
I came with
You have many props.
collateral.
You have many props today. So we actually have talked about this one already.
I brought the props. Let me hold them up.
Our program accountability report. We actually produce this report 2 times a year. So we do it at the 6-month mark and then at the end of the year. And this is like a snapshot look at the performance for every single one of the programs that we fund throughout the year. And it's very easy to read, easy to identify how the programs are performing. There's a lot of good information in here. Oh, you're like, wow, Vanna is doing a great job here. So
Keep it up, Pat. Pat Sajak. I'm making a wheel of fortune.
I got you. But the program accountability report is on our website. It's got a ton of information in it about how our programs have performed. And it's information that we actually use in our office almost every day to talk about how the programs are doing, to focus funding decisions.
Provide assistance to programs.
Lots of information
successful.
that's included in there.
And, you know, if you like data, and we love data, right?
We do in our office.
This is the program report to look at, because I was highlighting, we have a heat map that shows which zip codes have the most children served. So it's a great document, but I just want to remind everybody, and I know we're going to talk about this next publication, ton of numbers, ton of data. We're very much a data-driven organization, but please do not forget, behind every single number, every percentage, every child served, there's a story of a family that received services, got hope, and hopefully a better outcome because of the impact.
Yeah.
You want to talk about this one?
Yeah. So this is our relatively newly released annual impact report. Again, we do this once a year, and this is sort of a combined data and story look at our programs. We've got specific information in here. All the programs in that priority area will tell you how they performed as a collective. We also have some information in here about our budget, some more specific information about how dollars were spent, and some more specific information about some of the special things that we do that are outside of programming, like our outreach, our community engagement, the capacity building efforts that we have to train the professionals that are working in our programs. So a lot of really good information in there. We try to make it a really quick read so that you're not having to spend a lot of time going through it. But it is a really good glimpse at what we've been able to accomplish in the last year.
And it was beautifully designed by you.
Thank you.
So well done, as always. Why are you laughing?
I don't know.
But by all means, and by the way, if you watch this show regularly, our next show, we're going to read this word for word on camera. I'm just kidding. But download a copy. If you want to receive a paper copy, just give us a shout out at our office. And by the way, we are on all social media. Well, that's a lie. We're not on all social media. We're on Facebook, Instagram, and LinkedIn. Is LinkedIn considered social media?
Sure.
Okay,
yeah.
LinkedIn. And then end of story. That's, we're working on our TikTok routines, but we're not quite there yet.
No,
But,
they're not ready for public consumption.
but if you are on social media, and let's face it, you probably are, make sure you follow us, because not only do we provide information like this, but we also provide opportunities and things to do for families in St. Lucie County, as well as a little insight into the operations at Children's Services Council, maybe a little get to know us kind of thing, and, of course, some fun stuff.
Yeah,
That's
always,
that's a relative term. but
always fun stuff.
You know, and before I get on to this other information that we brought, we do want to give a big shout out. I kind of already gave them a shout out that we were getting a countdown from the control room, which is new, right?
Yeah, I love it.
It's kind of fun. Next time we'll ask them to start further. Like 20, 19, build the suspense. But we do want to give a big shout out to WLX St. Lucie, the St. Lucie County Public Schools channel. They have great programming. If you've ever, your cable provider has it, hopefully that's probably why you're watching us. And I apologize, you'll fall asleep soon. Just kidding. But if not, you can go look up WLX TV St. Lucie on the YouTube. On the YouTube?
The YouTube?
On the internets. On YouTube. And you can see all of their program, which includes this show, which goes back, I'm going to say almost 10 years.
It's more than that.
And believe it or not, and I can't believe this show used to be a weekly show.
Yeah.
A weekly radio and television show. And somebody higher up got smart and said, you guys need to go monthly.
I think we asked for that.
And it was literally in the studio. So anyway, if you want to see it, it's highly entertaining.
It's a good time.
You can watch the first show and this show and be like, yeah, they haven't gotten any better.
That's accurate.
All right, so the other things that we brought, by the way, we try to make the show light and entertaining, right?
We are light.
Because we're going to talk about some serious stuff here in a minute.
That's true. Okay.
Not serious stuff, but important stuff.
That's fair. That's
All right,
fair.
so Ashley already alluded, we do a lot of capacity building. We've really been ramping up our efforts this year. We do a master class in leadership, training soon-to-be nonprofit leaders so that when they step in, they're ready to go. You just graduated from Tier 2, Level 2.
Yesterday.
Level 1 wasn't enough to control her. Tier 2 is what she just graduated from yesterday.
Yep.
We also do, usually once a month we have a workshop. We have a workshop on AI and communications coming up. We just do a truancy workshop. But we do have some monthly reoccurring ones that we want to invite you to. If you are in the nonprofit world, you know that grant writing is essential. Whether you like it or not. Events and grant writing, fundraising, and getting money. We know that grant writing can be difficult, and a lot of times it's not that sole person's only responsibility for the organizations. So on the second Friday of each month at 9 a.m. in our training room, we hold an event called Coffee with a Grant Writer. It's a 1 to 1.5 hour session where you're going to learn components of how to write a grant. If you have questions about a grant you're working on, you can bring them there. We work with Jody Riley of Innovant Consulting, who is a professional grant writer. We provide the facilitator and coffee. So join us 9 a.m. on the second Friday of each month.
Because we really like coffee.
Because we like coffee and we like to monopolize all your Fridays. On the third Friday of each month at 8 a.m. Now, this is an hour early. I got some complaints about that, but leaders need to be up early, right?
That's what I heard.
So we have a workshop called Brewing Leadership where we talk about how to be an effective leader. And it's great because not only is it facilitated by Jesse, who has a PhD in leadership, but also you get input from everybody that's in attendance. This has been very well attended, but there's no reason why there shouldn't be more people there. That's why we're inviting you. Third Friday of each month at 8 a.m.
Yep, and that information is all on our website as well. So if you forget what date those happen, you can find them all on our website at cscslc.org.
So we have a guest.
We do. I'm excited that she's here. She's probably not as
I was
excited.
going to say, I was reading her face. I don't know if she matches your excitement, but I think she's excited to be here.
I love that she's here. So we've worked with her for a long time. I won't say out loud how many years it's been.
I don't remember.
But it's been a while.
I don't remember working in this category, ensuring every baby's a healthy baby, without Sonya in it. I can't remember pre-Sonya.
No, I don't think. There is no pre-Sonya.
Yeah.
Anyway, we have Sonya Gabriel is with us today from the Department of Health in St. Lucie County, which we have several programs that we do with you guys. But today we're going to focus on babies because who doesn't want to talk about babies? That's way more fun, right? But we did, I don't know how you want to start, but we did get some good news yesterday. We could always start with good news, right?
We could, yes.
So let's start with good news, and then we'll talk about the programs and what you guys are doing in the community.
So thanks for having me. It's a pleasure. Thank you again. So the good news, and this is 2024 data, that our infant mortality rate overall for St. Lucie County is at 3.3, which is the lowest it's ever been in at least 20 years. And then our black infant mortality rate is at 4.1, the lowest it's been also in 20 years. So the work that we're doing in all of our maternal child health programs and all collaboratively across the county is doing something good.
And can I just elaborate on that? It's better than the state, right?
Better than the
You
state.
get a
Which we love.
benchmark comparison, right?
is correct.
And when you look at the economics of our community, when you look at free and reduced lunch and whatever, we're kind of defying what is a normal statistical thing that would happen typically in communities that have 35% below poverty, and then when you look at the ALICE population, the working paycheck to paycheck, we're at 51%. We're kind of defying logic with these numbers.
That is
But
true.
also, I would say in the last 20 or 30 years, I'm doing the math quickly in my head, I'm gonna say that's close to a 70% reduction in infant mortality, which is huge.
Yeah, 10 years ago, when we really started deep diving into the infant mortality rates in this county, particularly putting a focus on Black infant mortality, which would put us back at 2014, 2015. When we looked at our data, our Black infant mortality rate then was 18.5.
Wow.
To put it into real numbers, we had 18 Black babies die in that same year. 18 infant deaths, and 15 of them were to Black babies.
Wow.
So that kind of it hits home when you put it into real numbers like that. And so with all the collaborative work that we've done, the partnerships and the new programming that we have created to specifically target the Black infant mortality rate, we are now down at 4.1. So 18.5 to 4.1
That's
is a
significant,
huge
yeah.
reduction.
And I'm gonna assume, just being a numbers nerd
I know
here,
you're a numbers guy.
Yeah. I'm going to assume by reducing Black infant mortality rate, that's the major impact on the overall infant mortality rate.
Correct.
Yeah, that's exciting.
Correct.
And can you talk about, and I know that's why you're here, and I don't want to jump ahead, but when that number was really high, we at the Children's Services Council, because we've heard you speak and other entities about this and kind of rang the alarm bell, you specifically designed programming to address that. And we jumped in to help fund it. So,
Yeah, so-
good segue.
Yeah, there you go. So with that being said, when we saw those high numbers in 2014, 2015, we did a 2-year FEMUR study, which is a fetal infant mortality review study. We hired a PhD level registered nurse to review the infant deaths in that 2-year period, and I'm going to summarize it very briefly. That basically, the majority of the babies that were dying were Black babies, which we knew by the data. Most of the babies that were dying in 2 zip codes, 34947 and 34950. Why was not so cut and dry, but some contributing factors were the lack of access to prenatal care and lack of knowledge when it came to the prenatal care services, and then of course unsafe infant sleep. So looking at those first 2 contributing factors, the lack of access to prenatal care and the lack of knowledge, I helped design our community-based doula program and our community-based breastfeeding program called Sisters Empowering Sisters. And with that, we started with 2 doulas that we trained from the community, from the Fort Pierce area, to provide community-based doula care services to mothers living in those 2 zip codes, 47 and 50. And we started that, again, being very targeted because that's where we were seeing the highest infant deaths. Then we grew, which was great. So now I have a team of 5 or 6 on the team. We've expanded our zip codes to include 3 in Port St. Lucie. So not only do we provide services in the 34947 and 50 in Fort Pierce, but also the 34952, 53, and 83 in Port St. Lucie. Those zip codes were chosen again because they were showing some higher rates of infant mortality. Different reasons, but nonetheless, still some higher rates of infant mortality. So we wanted to include the Port St. Lucie families as well.
And I just want to give a plug to, we kind of joked like we're going to hit you with a lot of data, like when we did the annual report in the PAR, but why the data is important, because in that analysis, because I remember that, and you and I had conversations about it, like really the predominant thing with those, from the FEMUR, from those reviews were they weren't initiated in any of the services that were provided.
Right.
And we provide, I said we meaning the community with which we help fund, a nurse home visitation program. Every birth can get a nurse home visit, and sometimes it's a follow-up visit. But what we found from looking at the data was in those 34950 and 34947, it's a voluntary program. They weren't participating. And what we recognized was we got to get into those families earlier with somebody that they trust.
Correct.
And that's the difference, I think.
Yeah.
The
And our-
special sauce, if you will.
The secret sauce is that trusting relationship that our doulas have with the moms and the families that they're serving. So our doulas primarily provide, they're birth labor support coaches for just general terms, but really the work is intense. They're providing a lot of prenatal education. They're creating and holding space for that mom, that expectant mom in the family, allowing her to learn, to voice questions, to find her voice, to speak up for herself if she doesn't understand something, helping her design a birth plan if that is her desire, and then again holding that same space and validating moms and families' wishes at the time of birth. Doulas are not medical, and everybody, she is part of the care team, and everybody is in their lane providing services for the same goal, that we have a healthy birth. And she's holding that space so that the mom, the family, can birth in the way that she hoped to. And not every birth ends up being beautiful, but when there is a doula present, the experience is that much more positive for mom. Not only that, but the birth outcomes, again, we look at our data, the birth outcomes, our C-section rates are lower for the moms that participate in this program. The babies that are born have really healthy birth weights. They're born at term, which is 37 weeks or more. They're breastfeeding at a higher rate than, compared to others. And then they're breastfeeding for longer. So not only did we initiate our doula program, but we also initiated our breastfeeding program, starting in those same 2 zip codes, 34947 and 50, with lactation consultants who go to the home. And the unique thing about this program is that it's an extended program, where, if you look at across the country, most breastfeeding programs are a couple of weeks after birth. This one's up to 6 months. And so moms are getting up to 10 visits, sometimes more depending on the situation if there's a lot of need. But on average, moms are getting up to 10 visits over a 6-month period with this lactation consultant. And the moms are loving it. So if I could tell you a brief story about one of the recent moms that we were servicing. She had just had her baby, had a lot of anxiety. She herself had some physical limitations. I think the baby might have had something as well. But she was determined to breastfeed, but her anxiety kept her at home, and she was very afraid to go out in public, which kind of prevented her from doing a lot of things. And so one of our lactation consultants said, well, why don't we, to get you accustomed to going out, let's go meet at whatever park they decided. It was gated park, it was a small little park, gated with shrubs around, so nobody was there to watch. They went at a time where it was quiet, there was nobody else there, and mom, the little 2-year-old, was playing on the playground. She was there with her baby, nursing on the picnic bench, and then they did a weighted feed, which is, weighing the baby before and after a feed, and mom was like, I can do this. So, it's like just the small little things of thinking outside the box sometimes just gets mom over that hump of that obstacle. Like, you know what, she can keep going now.
Well, I think one of the things that's so interesting about this program, and really most of our home visiting programs, or the programs that we have that attempt to reduce those barriers, is that we know from conversations with people in the community, a lot of people in our community, a lot of young families in our community have moved here without support. They don't have family nearby. Their family may live somewhere else. And so a lot of these young families don't have parents or help. And so being able to provide someone like a doula to walk alongside them through this really stressful, really high anxiety time can sometimes be what makes the difference in the success of that birth, of the start of their parenting journey, whatever that looks like for them. And so we hear stories like that one all the time, like a very simple
Yep.
support that really changed the trajectory of that baby and that family's life.
Yeah, it can be a game changer. Just the smallest thing can be a game changer. And then we started something new, which is our postpartum extended doula services, where this past October we had most of our doulas trained, or by October we had most of our doulas trained to be not only birth doulas, but also now postpartum doulas, which is another skill set. And so we are now offering up to 10 hours of additional postpartum doula support for our moms who went through our prenatal and birth doula program. And those 10 additional hours are offered in the second and third month postpartum. And so right now I think we have 24 or 25 moms currently enrolled in that postpartum extended services program. And we're doing a lot more monitoring for postpartum depression, seeing how the families are adjusting. You know, because in the first few weeks, it's a lot of hormones and everybody is happy, but then when everyone goes home, then what?
The relatives stop coming by and all the friends.
No one's bringing dinner
No one's
anymore.
bringing food anymore. And there's a lot of stuff that families are struggling with, and you don't really see it right away. But then when you're in that longer term relationship, like our doulas and our breastfeeding consultants are in, then you kind of see the other struggles, and then they're doing a lot of work connecting our families to other services in the community.
And I think when it started, again, because we recognized those 2 zip codes, those families, those babies and their mothers weren't really initiating in the systems of care that are currently exist. You went on a unique recruitment strategy for the doulas. Can you just briefly talk about that?
Well, it was
Just
initially...
to make sure that they were comfortable with the doulas, you made sure that the doulas were from...
So the initial plan was to make sure that our doulas were from the community that we were serving. So when we started the program 7 years ago now, I know, time flies.
Wow.
I know. The doulas that we originally brought on to do this program were from the Fort Pierce area. So they knew the culture of Fort Pierce. They knew the services. They knew the needs. They
probably knew a lot of the moms.
They knew the moms, and they knew how to navigate, that system, which is great. We've grown since then, so not all of our doulas are not from the Fort Pierce area, but they are all from St. Lucie County.
Yeah.
Right, and a lot of them have navigated a lot of the services that are offered themselves. So again, that also helps.
So before we get too far, I know we've talked about all the wonderful things. And so, if there's anyone who's listening who is considering this as part of their plan, can you talk a little bit about the service area that you guys are serving currently and how a mom could get involved if this was something that she is interested in?
And I'm going to add into that because I also have some logistic questions talk about, because we've mentioned doula, like everybody knows what a doula is, and you've explained what it is, but can you kind of go over like what exactly everything they provide? Because it's a long journey, as you've already mentioned.
Yeah, sure. So I'll start with your question first. So a doula, like I said, is a birth or a labor support coach. But we work with the mom prenatally. As soon as first trimester, if we get the referral, and then we're developing that relationship with mom, we're developing birth plans with mom, we're providing her prenatal education, anticipatory guidance when it comes to breastfeeding, navigating through some of the hurdles of, maybe she hasn't gotten into OB care yet, maybe she hasn't gotten into WIC yet, or other referrals to resources. Helping her understand what labor is, what the changes in pregnancy are, helping her understand what the different pain control options are during labor, talking about the different positions that mom can get in during the labor process, and then they actually practice that. So getting on a birthing ball or using what's called a rebozo, which is basically a big sheet, and you wrap it around mom in various different ways to relieve pressure off certain parts. It's a fabulous technique. A lot of affirmations, like, you got this.
Just that support.
That support. Like, I think of the movie, and I can't remember what movie it was, but it was a coach drilling one of his football players, and his football player was on his hands and knees at the end of the football field, and he had another player on his back.
And he was blindfolded.
And he was blindfolded. You know what movie?
I don't know if it was a movie or it was a clip. I've seen it. Yeah, I've seen what you're talking about.
And the coach kept pushing that player on. And before you knew it, he was on the other
full
end of the
length.
field.
Yeah.
So this is our doula, right? Our doula is like, you got this. You can do it. Our lactation consultants, again, from one end zone to the other, 6 months worth of breastfeeding, you can do this. We're going to navigate some of the hurdles, but you can do this. And then once mom goes into labor, which is important that they call her doula, because that's really, really important. If she doesn't know you're in labor, she can't help you. Then she's going to report to wherever you're having your baby, whether it's a planned home birth or at the hospital. And then she is there for the duration of that labor and delivery process. It could be a few hours, it could be a few days, just depends. And she is there working with mom on pain control, working with dad or whoever is in there as her other support person, on helping mom with those pain control options, different positions, communicating between the mom and the family and maybe the medical team of what her needs and wishes are. Once baby is born, helping with that transition period with some breastfeeding and just bonding. And then 2 postpartum visits in the first month postpartum. And then, of course, if mom wants her extended postpartum, then up to 10 hours or 10 additional visits in months 2 and 3, just to make sure and check in, like get her to that end zone, right? Like, you got this, and how can we help you get there?
Awesome.
That's great.
That's
and
very
so, to Ashley's point, if somebody's, like I know somebody that's expecting and they're interested in a doula, how do they get connected to the program?
Yeah, so actually the easiest thing to do is just to call me directly, which is 772-462-3955. But if you want more information, you can always go to our website, which is stlucie.floridahealth.gov.
And I know we got a couple of minutes left, and I see you have some handouts, and I don't know how much detail, but the doula is just one component of the system of care.
Yeah, can we talk about the map? Because this is my favorite
We
thing.
can.
Yeah.
So,
Who designed it? Did you design it?
yes, with help.
With help?
Yes.
In Canva?
You know what? Yes, I think
Okay.
so. I think so.
Ashley's getting
There were
ideas.
so many parts.
Yeah.
So I have to give kudos to our communications team because they really did the final design. But what this is that we created a system of care for our maternal child health programs in St. Lucie County, more of in a continuum of care design. So where are we? Pregnant mom enters our system of care, and then she can access any one of these 30-some services from pregnancy, birth, and beyond. And these are all local services available in St. Lucie County. When we started this continuum of care, which was not as pretty as this, we had 20 partners.
Maybe.
And now we're over 30.
That's very cool.
And it doesn't mean, like, if somebody's looking at that and like, well,
I have to
had
do
a
all of
baby, but
those.
I don't have, this isn't
Yeah.
life where you have to hit every stop. I'm sorry,
Correct.
the board game, sorry. So not everything on there everybody has to access, but that's the support for when you need it when it comes to newborns in our community.
That's correct.
Yeah.
That's
It's very
really-
cool.
It's very cool. And that map exists somewhere that people can access?
Not yet. I'm
Okay,
still
okay.
working on getting things digitized, but we do have available handouts. So these will be given to all of our partnering agencies, and then those partnering agencies will obviously be handing those out to the clients that they're serving.
And
I love it.
I think it's important as we wind down the show, if you know anybody that's expecting a doula experience, as you know, is like having a coach or a cheerleader by your side, which, I'm not a mother, obviously, but I'm married to a mother, and the birth experience is different every birth.
It is.
And there's stressors that I don't care if you've read What to Expect When Expecting, something happens that's not in that freaking book.
Is that book still out there?
Yeah. So can you give your number one more time?
Sure. It's 772-462-3955.
And if you're like listening and you're like, well, Sean, we don't have babies, whatever, just know that this is just one system of care, that this community is here for our families and our children, and that's very representative of how we support our kids and families in St. Lucie County.
Yep.
Thank you so much for
Thank
coming
you
on.
for having me.
I didn't get the memo about wearing red for Valentine's Day,
hey,
but
you know,
we'll
we're
talk about
just-
that later. We want to thank everybody for tuning in. It's a monthly show, so we'll see you next month. And a reminder that it's our children, our community, our future. Now more than ever, folks, we're all in this together. We'll see you next time.